Hello, my name is Kevin Ohlendorf, and I'm the president of the Ohlendorf Appliance Laboratory. This video is going to focus on the Wilson 3D Multi-Action Expander. The Wilson 3D system is a fixed, removable appliance system that allows you to remove the appliance without having to take off the bands so you can adjust and activate it. This light wire appliance is very comfortable and easy for the patients to wear, but at the same time it is very powerful and versatile. Our laboratory was one of the first certified Wilson 3D laboratories in the country, and we have a very long history working with these appliances. In this video, I'm going to show you the many uses and functions of the Wilson 3D Multi-Action Expander. I'll also show you how to adjust it to achieve the results you want. Let's get started by taking a look at how the vertical slots on the molar bands work.
The entire Wilson 3D fixed removable system is designed around the vertical slots on the molar bands. The slots allow you to remove the appliance to adjust them and activate them, but the patient cannot take them out. On the bands are the two slots, and the appliances have posts that fit into these slots. A friction lock holds them in place, so they're very secure. You do not need to tie them in place once they are inserted. Let's take a look at how to insert and remove the appliances. In order to remove the appliance, you'll need to use a scaler and place it between the two posts and up onto the occlusal surface of the molar. Simply rotate the scaler using the occlusal surface as a fulcrum. Remove one side at a time until the appliance comes out of the vertical slots. You can now make any adjustments that you need to make to the appliances. When you're ready to insert the appliance, simply put the longer of the two posts into the corresponding slot and push it into the slots with finger pressure. Then insert the appliance on the other side the same way. You may want to use a band seater to make sure it's fully inserted. The appliance should be below the occlusal surface so it does not interfere with the occlusion. The appliance is now locked into place so the patient cannot remove it. Now that you know how the vertical slots work, let's take a look at some of the different 3D appliances. The Wilson 3D Multi-Action Expander is a very effective upper appliance with many uses. It can be used as a first phase appliance or worn with straight wire. This light wire appliance can produce great results. As an active appliance, you can get bilateral expansion in the molar and anterior regions. If the arch is very V-shaped, you can activate the sweep arms in the anterior section to produce better arch form by widening the anterior region but not the posterior region. In a true unilateral crossbite situation, you can expand one side more than the other to gain arch symmetry in the arch. The sweep arms can be activated to flare the anteriors forward as well. Many doctors use this appliance for retention after arch development, just like the 3D lingual arch is used on the lower arch. If you have done rapid palatal expansion, you can place this appliance to maintain your expansion instead of having the patient wear a bulky skeletal expander long term. It is also very good to place after distalization. It will hold the molars in their new position as you begin to consolidate the teeth. The multi-action appliance provides excellent anchorage and maintains arch form that you have created with the other appliances. You can also use it with straight wire to push from the lingual as you pull from the facial with the arch wires. It will quickly help you develop and round out your arches. This can be a very good appliance for adults. The appliance is contoured to the palate very closely, so it's easy for adults to tolerate. There's nothing in the palate, so it does not affect the speech. Let's take a look at how to adjust this appliance in order to expand the arch in the molar and anterior regions. When you receive this appliance back from us, it will be passive. To activate it, start by measuring the molar region where the wire attaches to the post and record this measurement in the patient's chart. Then make a mark on the wire in the first bicuspid area and measure this distance and record it in the chart. In order to expand bilaterally and in the molar and bicuspid regions, you will need to make 2 adjustments to the diamond. You can activate the appliance about 4 millimeters at each adjustment. To activate the appliance, take a bird beak instrument and open up the diamond to expand the appliance. When you do this, the arms will move distally, so you'll need to make a compensating bend to straighten them. This bend is made so the posts will line up with the attachments on the bands again. Now measure your 2 points to verify that you've widened the appliance about 4 millimeters in the anterior and posterior regions. Once you have activated the appliance, you can insert it. You'll want to see the patient about every 4 weeks. This will give you your expansion of the entire arch. If you only want to expand in the anterior region, activate the sweep arms instead of the diamond. Place a mark on the wire where you want the expansion to start and measure this distance. After removing the appliance, grab the wire at this mark with the bird beak instrument. Then use finger pressure to widen the wires about 3 to 4 millimeters. Measure the amount of activation to verify it, and then insert the appliance. If you just want to flare the anteriors forward, do this same process starting at the cuspid area. Sometimes the sweep arms have a tendency to ride up the lingual of the teeth, so a button or composite shelf can be placed to hold the wire at the gingival margin where it needs to be to move the teeth. There are many uses for the Wilson 3D multi-action expander. This light wire appliance is very comfortable for patients to wear, and it will produce some very powerful results on the upper arch.
I hope you have enjoyed this video on the Wilson 3D multi-action expander. If you'd like to try one of these appliances, just send us an upper working model. We'll fabricate the appliance for you and return it to you ready for you to insert and activate. The most difficult part of fabricating these appliances is getting them passive, and our skilled technicians will do this for you. You do not need to pre-fit bands if you don't want to. We can supply them for you when we make the appliances. If you do want to send along your own bands, you do not need to pour them in the model. Just send them separate in a plastic bag. You'll also want to oversize the bands by 1/2 to 1 size larger than normal. When we attach the 3D lingual tubes, they have a tendency to shrink the bands a little bit. Oversizing the bands will allow for a better fitting appliance. I encourage you to try this appliance. The 3D multi-action expander is a light wire appliance that produces great results with minimal adjustments. It has many uses like I've outlined in this video. We also have a free technical manual that I can send you if you'd like more information on this appliance. Call us and we'll send it to you right away. Thanks again for watching this video, and to guarantee you receive the highest level of quality and expertise, make sure you have all of your appliances fabricated by the Ollendorf Appliance Laboratory.